Oh, your cat has an ear polyp and your veterinarian simply yanks it out. Problem solved, right? Sometimes, but not always. Depending on the extent of the disease, the recurrence rate after simple traction can be as high as 50 to 60% in some reports. But a new study of 154 cats really helps explain why. Feline inflammatory oral polyps are benign inflammatory growths that arise from the middle ear or the eustachian tube. They're not cancer, but they can cause significant disease. Chronic ear infections, head shaking, ear discharge, head tilts, balance problems, and something known as Horner syndrome. Sometimes the polyps grow into the back of the throat, causing noisy breathing or even difficulty swallowing. So what did this study actually evaluate? The researchers reviewed 154 cats that were diagnosed with inflammatory oral polyps between 2019 and 2024. They evaluated clinical signs, CT scans, MRIs, video otoscopy where a little camera goes into the ear canal, and surgical treatments and outcomes. And guess what they found? One finding in particular really stood out. More than half of the cats, 51%, had disease in both ears, even though they only presented for disease in one ear. There was no association between laterality and age, breed, or sex. The biggest finding, nearly 98.5% of cats had disease involving multiple compartments of the middle ear. Now that's really important because what you see protruding into the ear canal is often only the tip of the iceberg. The inflammatory stalk frequently extends deep inside that tympanic bulla. So traction avulsion basically removes the visible polyp, but it leaves the base or the stalk behind. If inflammatory tissue remains within the middle ear, the polyp can regrow. Published recurrence rates after simple traction avulsion, they've ranged from 35 to over 50%, with some of the older reports approaching 60%, depending on the technique that was used and the patient selection. More advanced endoscopic traction, again using a little camera, those techniques have reduced recurrence rates to under 15%, but recurrence is still much higher than with definitive surgery in those appropriately selected cases. Now, CT and MRI or advanced imaging really matter because it shows us the tympanic bulla, the extent of the disease, helps for surgical planning, the soft tissues, the inflammation, the neurologic involvement. So instead of just guessing, we know exactly where the disease is before surgery and if it's in both ears. So the study found that ventral bulla osteotomy, either alone or combined with traction, was the most commonly performed procedure. 0 recurrence rates were observed in cats treated with ventral bulla osteotomy during the study's follow-up period. The authors note, though, that long-term follow-up was not available for every single cat, so the absence of recurrence should be interpreted with that limitation in mind. Now, does every single cat need a ventral bulla osteotomy? No, not necessarily. I mean, many of these cats improve with traction avulsion alone, at least for a period of time. And if imaging shows extensive middle ear involvement, or if the polyp recurs, ventral bulla osteotomy may provide the best opportunity to remove the entire disease process and reduce the risk of reoccurrence. So an ear polyp may look simple, but what you see isn't always all that's there. Advanced imaging helps reveal the true extent of the disease, and when the middle ear is extensively involved, a ventral bulla osteotomy may significantly reduce the risk of reoccurrence compared with just traction alone. So have you ever managed a cat with an ear polyp? Did it recur after traction avulsion, or did you proceed with just a ventral bulla osteotomy? Let me know in the comments and follow for more evidence-based veterinary medicine.